All right, and I know we might still have a few folks joining us in a little bit, but glad to see you all here. This is our May 2021 Canvas meeting. I am Brett Nachman with College Autism Network. Most of you have been here before for prior Canvas meetings, but if this is by chance your first time, welcome. This is our space for sharing news and resources and ideas with fellow members of the College Autism Network landscape. Many of you we know are practitioners or researchers or self-advocates or community activists and perhaps even many roles as well. And we all have a common thread, of course, being autism and post-secondary education. A few friendly reminders before we get started. One is that to please make sure your name is listed in the meeting agenda. I'll drop a link to that once again in the chat. And to please highlight your name to indicate that you are present, because we do record those details just to make sure that's in our records and we know that you're part of our meeting. Also too, if you are not talking, communicating verbally, please be sure to mute your microphone. That way we can eliminate any background noise. Otherwise we'll do that on our end. Just we want to make sure that the audio quality is clear for everybody possible. And if you have a question or something to contribute, feel free to use the chat. Feel free to speak up and unmute your microphone. And we obviously welcome your input. So today, you know that our featured presenters, we have a wonderful trio today. So we have Dr. Jess Monahan, Laurie Ackles, and Cherie Fishbaugh, who are among the co-authors on a recent article. We talked about it actually briefly at our last Canvas meeting, and really appreciate all of them stepping in today in light of some scheduling changes. So we'll get to their remarks in just a few minutes. We also encourage you all as attendees, if you have a recent article that you've come across or a resource that you think is going to be helpful for folks to know about, we have a space in the meeting agenda toward that end where we're going to exchange some resources. So feel free to drop that in or mention it, and we can certainly add details later. Also a reminder to folks, we know many of you, or if not most of you, are on our Canvas listserv. This is how you hear about our forthcoming Canvas meetings, where you'll get notes, minutes, presentation, PDFs, and video recordings of our meetings. And also we see a lot of research studies being disseminated, which is great. And often we're seeing examples of folks prompting questions to the community and seeking assistance. So obviously this is a great group, as many of you know, to be able to offer assistance and ideas. Those are a handful of my remarks. Also too, and as a heads up to folks too, we will be taking a quote-unquote summer break from Canvas in June. That's kind of our common thing, but we will be resuming meetings in July, and we'll be releasing details about those meetings in the coming weeks. So you'll want to stay tuned for email updates on that and who's going to be serving as our presenters. So this is our space now to share any resources. I usually drop a little something in to get the conversation rolling. One recent article that debuted in I think it was the Milwaukee State Journal, is a new great program out at Milwaukee Area Technical College that enables autistic college students to gain real good field experience in CNC machine operations. Not necessarily a space that I'm terribly familiar with, but it was sure cool to read about, and I encourage you to check it out. It seems like it's through the Uniquely Able Academy or project, if I'm not mistaken, and seems really useful, and you might be interested in checking it out, and that is on the meeting agenda. All of these details that we mentioned will be in the meeting minutes, so no need to furiously take notes unless you choose to do so. We'll have it cataloged for all of you. I'm going to turn it over to whoever added the detail about an article on treatment of sleep problems in autistic adults.
That was me. You know, I'm working with a lot of students at Mansfield Hall a few years ago, I just found their sleep hygiene issues to be really pretty profound. And so I was interested in this article that I've dropped in, the treatment of sleep problems in autistic adults in the UK. And it was instructive. Not a lot of great ideas that are beyond the usual sleep hygiene ideas, but good science as a background.
Great, thank you for sharing, Lee. And I think I saw that Theo dropped a recent article based on your PhD. Congratulations.
Yes.
Or go ahead, tell us about it.
Okay, thank you very much. Yeah, it's my second article in series of 4. This is on the first year progression of students in the Netherlands. It's a propensity score weighted population study of about 25,000 students without ASD and 100 with ASD that we compared. And I'm almost finished with the third article on the degree completion of the same group. So that will be hopefully within a while, half a year, hopefully published. So it's published on open access at well, I'm curious what you think about it. Yeah.
Thanks for sharing that with us, Theo. And
Yeah,
great that it's open access too.
Yeah, it's thanks a grant from the Autism Union in the Netherlands. Yeah.
Theo, there is a question in the chat from Kristen as far as what are you hoping, what are you finding in terms of degree completion? If you want to just briefly address that.
Yeah, yes. Well, I think it's important to notice that differences are very small if you control for differences in the background. So propensity weighting scores makes it that the differences are very small, and it's important for these kind of students to look at the second year's results to make a prediction on the third year results. Especially non-attendance in the second year is a major prediction for taking more time in the third year. While for other students, you can look at the first year and the second and the third year. It's more like an ongoing information. So when you normally would look at only the European credits, we now find that you should look at non-attendance in students with autism. And the third article is a structural equation model. So it's really like an analysis in a path analysis. To be honest, I'm a bit of surprised by the question, because you're the first group I told it's almost finished. So, but I'm happy to talk more about it maybe at a later time if you want. Yeah.
Great, thank you so much. That's very exciting.
Thanks.
Does anybody else have any updates or resources they'd like to share with the group? And I can add that it could also be highlights in your life. If something good is happening and you just want to share good news, that's always welcomed as well. Okay, well, if anybody wants to drop anything in a bit later, you are welcome to do so. You can put that in the chat or in the Google Doc, of course. We have a good amount of time for our featured speakers. So at this point, I'm going to turn it over to Dr. Jess Monahan, Cherie Fishbaugh, and Laurie Ackles. The presentation, again, is called Understanding Autistic College Students' Needs in the Times of COVID-19, a very timely piece. And certainly, as I said at the onset of the meeting, really glad they could jump in to serve as our May 2021 speakers. We'll have about 25 minutes or so toward the presentation, 25-30 minutes, and then time for Q&A. Feel free to drop in questions, comments in the chat, and we'll also have time for that once the presentation concludes. So I'll turn it over to them and we'll get started.
Great, thank you so much. So I am Laurie Ackles. I am the director of the Spectrum Support Program at RIT, and also manage the Neurodiverse Hiring Initiative program that we have at RIT as well. I'm currently in a doctorate program at the University of Buffalo for this in the School of Social Work, studying implementation science with a focus on technology and trauma-informed practice. That's how UB does their program there for social work. So, and I will let my co-presenters introduce themselves.
I'm Jess Monahan. I'm the research manager at Spectrum Scholars. I'm also recently an assistant professor there in the School of Education, and I focus my research on students and young adults with autism, with specific focus on autistic voice, social relationships, and mental health.
And I'm Cherie Fishbaugh, and I'm the Director of Autism Services at Westchester University, right outside of Philadelphia. Been working in the field for 20 years. I actually started out doing a lot of early intervention and working. I almost went through the progress like my students did. I started out early intervention, really got into elementary schools and then high schools, and then kind of went into young adulthood and adulthood. So you can see my ranges from years of working with individuals from the age of 18 months all the way up to the 60 years of age. My clinical and research expertise is in applied behavior analysis, positive behavior support, and social relationships.
So Jess is going to be in charge of the switching of the slides. I'm going to start out just by sort of letting you know what we're going to talk about, and basically just introducing the study. Jess will go through some of the findings, and then Cherie and I will talk about some of the recommendations and how we've sort of used those on our own campuses. So I think the interesting thing about this study is it was really a collaboration between practitioners who are working in the field with students on the ground every day, and research people who are focused more on you know, taking that information and using it to improve practice, and then some of us who are trying to do both. So you can go ahead and switch it. So again, this is Autistic College Students and COVID-19, Anxiety Support Needs and Responses by Specialized Programs. So we really, you know, when COVID hit last spring, which seems like it was 100 years ago now, all of us lost routine and structure. There was a ton of uncertainty, which was really, really challenging for all of us. And what we were trying to do is figure out, so once we got through spring semester, what can we do to make sure that the fall is runs more smoothly, that we have some plans, that we can be proactive about the work that we're doing, and how can we share some of the information with other universities who are also supporting autistic college students. So this was a survey only, so we didn't do any follow-up or anything like that. It's simply based on responses to a survey that we sent out. The sample is quite limited. I'm giving you the limitations from the beginning so that you kind of know where we're headed. We did end up with 76 respondents. The sample primarily came from students who were being served by specialized programs at colleges for autistic college students. The sample is, like many of our programs, probably heavily skewed white male. And just to think about when we presented the data and wrote up the article, is that, you know, things change so quickly, that this data is from when collected in the summer prior to the fall 2021 semester. So these were our questions. How has COVID-19 impacted anxiety for autistic college students? What are the common concerns that they have about coming back to campus, online learning, in-person learning, dealing with education in the face of COVID-19? And then what can we do to help make sure that we have supports in place that are going to be supportive for students as they go through these challenging semesters. So the survey that we sent out was created by a program staff. We have a group called the Alliance, the Autism College to Employment Programs. There's 5 universities who are currently meeting on a bi-weekly basis. And we worked together to create the survey that, so it was based on our professional expertise, the work that we had done with students in the spring semester, what we knew was coming up in the fall semester. We had a lot of demographic questions. We wanted to know about their housing, whether they were enrolled, how they were getting to classes, where they were in their college program in terms of years, and how many credits they were taking, things like that. So a lot of demographic questions. Then we had scaled questions about anxiety, focused on things related to COVID-19, related to online learning, in-person learning, and then some open-ended questions, asking about how can we support them emotionally, socially, academically, what were their concerns specifically about online learning and about in-person learning as well. We sent the survey, before we sent it out fully, we sent it to some autistic college students in some of our programs for feedback, just to make sure that, you know, the items were clear and that to see how long it would take for students to fill it out and things like that, and made adjustments from there.
Always have to remember to.
Oh, do you do this, Cherie? Sorry.
I do.
Ignore me.
So thinking of the findings, so I'm going to talk a little bit about demographics, and then we'll get to you, Jess, to talk more about the qualitative stuff, okay?
If someone could just tell me when to talk, that would be good.
Perfect. Gotcha. All right. Well, as Laurie said, there were 76 participants who responded to the survey. It spanned across 14 states. A majority of the participants were right here in the state of Pennsylvania, but they other states who had a lot of participants included Michigan, New Jersey, Delaware, and don't worry, we do have participants from California. And they've got the West Coast in there as well, Wisconsin. But 70% of the students who are the participants who responded were supported, as Laurie said, by autism programs. And then when it comes to housing and thinking of where they're going to be, where they were going to go in the fall, about 35% plan to live on campus, and approximately 77% were going to live off campus but by the campus. And 47% were at home with families, and 9% at the time still didn't know. Again, we think about that constant involvement. We didn't know what was going on with the pandemic of, do I live on campus? Are they going to be back in place full time, in person, hybrid, what was going to look like? So when it comes to age, majority of the students were 19 to 24 years of age, so looking at 75%, and then almost 24% of them happen to be under the age of 18. When we're looking at race, again, as Laurie had talked about, we once again have 81% being white, and next came biracial, followed by Asian and Black African Americans.
And this is my fault. That header on that pie chart should say race, not ethnicity. I tried to find the chat and I couldn't. Sorry.
Oh, there we go. ethnicity, gender. Like, wait, where am I at now, Jess? This is what happens when I don't have control over things. So then we're looking at gender. Again, I feel like I'm repeating myself, right? It's that what Laurie had said, where it's primarily males with 68% males, 28% female, and 4% non-binary. So just as a nutshell, as Laurie had said, majority of our participants were white males. And then when it comes to what year they were in school, so again, we're looking at the majority of our students were in anywhere from the first, second, and third year, with the majority being in the first year. And the second and third years made up about 24% each. And credits that they were going to take in the fall. So majority of our the participants responded what they were going to take between 13 and 15 credits, with also almost 23% so they were going to take that 16 to 18 credit load, followed by the 10 to 12. So when you look at this and we think about credits, you're looking at full-time students. 12 credits equals a full-time student. So put that in perspective. So Jess, this is you. You are on.
Thank you for that explicit direction, Cherie.
You're welcome.
I know we already talked about and I forgot. So as Laurie pointed out in the beginning, we had 8 questions that were rated on a Likert scale. And so as a reminder, a 0 is not anxious at all, and 3 was a very anxious. So we basically asked students, thinking about when you come back to school in the fall, how anxious are you about these things? And so the 2 that were rated the least anxious are highlighted in green. And so that was mask wearing and social distancing. Those were the least of the worries for the students in this specific sample. And people were most anxious about getting sick with COVID and spreading it to somebody else. Spreading it to somebody else was actually the largest or the most anxiety producing score out of all of them. You can see too, I put in that second column the number of people that actually answered those questions, and you can see it's interesting that the 2 that are related to being in person had lower response rates. And so we don't know this for sure, but the hypothesis is that they were like, well, I'm not going to class in person, so I'm not going to answer this question. Maybe because everybody else pretty much responded. We had 76 respondents, so pretty much everybody else responded altogether. And we were like, when we first saw this data, when we met as a group again, we were like, wow, that wet mask wearing, right? Because in the beginning, we were all talking about how when we were interacting with people that we were, like my son is autistic and he wouldn't wear a mask, and some of the students that were in our programs were saying, I can't wear the mask, can't do it. And so we were expecting that one to be pretty high, right? And it came back really low. And so it's just another reminder how important data is, and how just because you have anecdotal or personal experiences doesn't mean that when you get a larger sample, that's what you're going to find. And we also really wanted to highlight the fact that the concern for others' health was the biggest anxiety. And so I thought that was something that was important to highlight. And we asked explicitly, what is your preference for services? 53 people responded to this one. And this was specifically talking about autism support program. So do you prefer that it is fully online, that it is in person, or a combination of both? And there were people who had no preference. Now, the one thing about this, and I wish we had thought to ask this, we asked this in the middle of the summer and gearing up for the semester, right? What I wish we had asked was post-pandemic, although I think none of us are really thinking about a post-pandemic life last summer yet. Post-pandemic, what do you want your services to look like? Do you want them online? Do you want them in person? Do you want a combination? And so this data point and things we'll talk about a little bit later in the presentation, I think serve as a reminder that accessibility with allowing some online support is probably not going to be a bad thing. And then we have qualitative results. So we just did a simple thematic analysis on this. Myself and our graduate student, we calculated our inter-rater reliability and all of those fun things. So if you want more details on that, they're in the paper, or I can talk about them after. The other thing here to kind of save time and space is we only highlighted the top 3 themes that came out of each of these questions. So in the paper, we list all of the themes that were identified. And so this one is just highlighting the top 3 response types when we said, hey, how can your institutes of higher education and your programs support you? So the most commonly cited one was academic support and consideration. Students were really, really worried about academics online and kind of like the logistics around it. And then the next most commonly cited thing was just this idea of general support. I mean, there's one quote that sticks out to me all the time is someone was just like, I don't know, just check in on me. Right. And how like that just felt so relevant and real because that's what I wanted. I just needed somebody to just check in on me. And then 14 times social support was cited. So creating explicit opportunities to figure out how to engage in a remote environment, which makes sense, especially when we think about a good chunk, I was at 30% of the sample was first-year students. And so, you know, I'm sure that was like top of mind, like how am I gonna figure out how to socialize in college when I'm on the internet? Then we asked, what kind of concerns do you have for online learning? And again, we saw the academic component really strongly. Obviously, it makes sense we're asking about online learning, but thinking about attendance and work completion. So there was some stuff about motivation and how am I going to figure out like how to keep everything organized and how to do this. Then students were also really worried about like the logistics, the actual how-tos, like saying things like, I don't know even where to go to get to my classes. Like, how do I know what links to click and how am I going to get the supports that I need? What is this going to look like? And then the last one was the quality of learning. People were really concerned that if they were fully remote, they were not going to get the same academic experience and learn as well as if they were in person. And then finally, we asked, all right, so what are you worried about for in-person learning? And probably not surprisingly, the most salient thing that came up was being worried about catching COVID. And it was interesting because the second biggest category was this miscellaneous or like, I don't know kind of thing. It was kind of a catch-all because this question was so hard to code for. There really just were not a lot of themes that came out of it. So this miscellaneous pile included things like just expressing general concerns over in-person learning. Like, I don't want the university to do this. People talked about, you're going to charge me full tuition. This is tuition's too much, which feels kind of like abstract. Unexpected changes in delivery format, like, are we going to be in person? All of a sudden we're not. And then really feeling strongly that there was a lack of planning from the government and the institutions of higher ed. So it really was kind of like this giant bucket of stuff. And then the other theme that came out was being worried about other people following safety procedures, which now that we're a year plus into the pandemic, feels right with college students. So that kind of sums up the qualitative stuff. The next stuff I'm super excited about, and I'm going to stop talking as soon as I say that I was really, really thankful to be able to work with this team of like brilliant people who like were so willing to like do the research with me and then tie in the recommendations. And I'm so excited to just sit back and listen to them kind of talk about what it looked like in practice. So.
Well, thanks, Jess. So I have to also say, like, I mean, it's amazing to be able to work with other directors, and I will tell you that Laurie has given me so many ideas throughout. I mean, it's just great as a director of a program to be able to reach out to people and ask for help. And where these recommendations came from was actually, you know, the Alliance group, the 5 directors sitting around and talking about like, what changes do we need to make within our programs? We're going virtual, there's COVID, mental health, like how do we help academically? So we're going to talk about our recommendations in those categories, and then how Laurie and I put it into practice. So with a few examples with that. So when it came to academic recommendations, the top 4 that really stood out to us was 1, helping with the executive, providing that executive functioning support, right? They're used to having their calendars and checking in with us and doing those things. How can we help them virtually? So making sure that they had access to different types of planning apps and processes. So using Google Docs, because no longer, we needed something online to be able to work collaboratively with something, whereas before they were in person and we could just pull it up and work together. Being able to use assignment trackers, setting goals. How do you work backwards from something of you have something planned that's due in 3 months, but it's a large project where before we could sit down and look at it, now we need to have some ways to really do that from a virtual standpoint. Looking at that access to staff, you see, you heard Jess talk about the concern and the famous, infamous line of, I don't know, just check in on me. I need access to you. I need to know where you're at. So we had to look at it as how do we make our staff accessible to our students? So having those online scheduling appointments, having things like those mass text messaging systems, whether it be Discord or GroupMe apps, so they knew how to get a hold of us, certain virtual hours that we had available for them. Making sure that we had our phones connected as well, to where it wasn't just coming into the office, that, what was the tool to be able to use that we could get those phone calls being at home as well and working from home. Setting up those tutoring opportunities, again, it's, wait, I'm used to being in person. What do we do? So making sure that academic support services were there, understanding the different types of online tutoring. So whether that be smart thinking or other things that your university may have, looking up faculty's office hours, because many of our students would, one of the things that I know my students particularly talked to me about was, I just liked being able to walk into my faculty's office. They didn't really pay attention to office hours before. They just liked that walking in. So understanding now where are the faculty office hours listed. And then as I kind of put into all these, it's really those check-ins, right? The virtual meeting platforms, the breakout rooms, having checklists, calendars, agendas, whiteboards, all those things available so that we're there to help check in with our students. So how do we take that and actually apply it and put it into practice? So some of the examples, Jess, do you mind going to the next slide? Excellent. So some of the examples that we end up doing is, I had students who really, actually I had several students who came to me. It wasn't actually fall semester. It was more of winter session, where now it's been a semester and a half and they're saying, I can't stay motivated. We've worked on all these check-ins. We have those weekly meetings. We're doing these things, but I can't stay motivated and on task when I'm at home in this environment. So 2 of the things that we put in was with 3 of my students actually in the winter, they started self-monitoring. So they identified what they wanted to work on, of staying on task, and then what does on task look like for that assignment? And so we taught them very quickly, they got to pick out what their interval schedule was. They were going to self-monitor, and as on the side as a researcher, I'm going, all right, you're going to do a momentary time sampling. That's all in my head, right? Our students actually, the 3 who went in and implemented this for the entire semester, were on 3 different duration schedules. There are interval schedules on 3 different types. One was using partial interval, one was whole interval, and one was actually momentary time sampling. But they got to create that for themselves as to, hey, this works for me. And all 3 were extremely successful with getting their work done on time. And previously, I would tell you, they weren't able, they were late assignments often, and this really helped them stay on task. For the check-in, check-out, we were very fortunate here at Westchester to, even though we were remote, we at DCAP were able to have in-person services. So I did have about 10 students who came in on a weekly basis to work with inside DCAP. So we did this check-in, check-out system with them where they got to actually, they told us what time they wanted us to check in with them. I guess I should say this actually happened with some remote students too, now that I think about it. But then they were also looking at, like, what's your goal in between this check-in time and your next check-in time? What strategies are going to implement during this time? Am I a self-monitoring student? Am I going to use the Pomodoro method? Am I going to reduce my distracting environment? So they were already thinking of the kind of the strategies to put into place when they're going to sit down and do their work. And then they got to say whether or not they met their goal. If they were a student that was coming in and using this, or at the end of the day when we did a check-in, kind of like a check-out, right, we would say, okay, here are your classes. What's your plan for tonight? And then they would fill out that section so they knew what they needed to complete at home or later after hours.
Thanks, Cherie. So this is some of what we did at RIT. We used a Google Doc, what we call the student planner. It had 5 or 6 tabs on it. Students used it in different ways. Some students liked the weekly to-do list. Other students liked a weekly schedule. There was a tab for their goals that they set with their coaches, and a semester calendar so they could set out the whole semester. It was shared with the coach and with the student, so they were able to work on it together. The two other things that really, I think, helped our students is we set up a Calendly where students could ask for a meeting at any time. So they just clicked on it. There was a whole bunch of times available, and they picked something that worked for them. They had the Zoom link already there, and it was really easy for them to get extra support. Our coaches did a great job of pushing students to the Calendly as well. So when a coach was meeting with a student, if they needed more time, they pushed them to the Calendly, and then a staff person was able to take care of that. And then we use text-free a ton to check in with students, let them check in with us. It's a free texting app. All of our staff have access to it, so whoever gets the message can respond to it. And it's just a way for students to be able to reach out and say, I'm worried about this. This just happened. You know, things like that. So that kind of immediate support that, that students were looking for. I don't know if this is supposed to be me, but looking at wellness, some of the things that that we thought were important to think about in going into the fall semester was certainly working with all the anxiety that students had around COVID, around online learning, around hybrid schedules, and the chaos that they were probably looking at facing in the fall semester. So helping students set up self-care routines, using mindfulness, of course, referring to counseling, which most of it was done remotely. That kind of thing is really important. Making sure that students are scheduling in not just work time, but also breaks to be able to take care of themselves and have that time for social connection as well. And then helping students prepare for what the fall was going to look like. That was a pretty, there was a lot of uncertainty for all of us. And so making sure that students really understood what their requirements were going to be. At RIT, students had to do a daily health screen, which of course in the spring, you know, wasn't something that was done. So all of our universities spent the summer creating these safety plans, right? And then we had to make sure that our students understood what was their obligation in the safety plan. What did they have to do in order to be on campus and that kind of thing. So a lot of talk around that. At RIT, we did what was called a pulse survey. RIT did it in the fall. The Spectrum Support also did it with just our students in the fall. And then we did it again in the spring. You can see that it's probably a little bit backwards. Spring is on top, fall is on the bottom. But you can see RIT, fall of 2020. They sent out 1,700 surveys to students and got 240 of them back. They did it weekly during the fall, toward the end of the fall semester, and asked students to describe their own mental health. Was it fair, poor, good, very good? And in our numbers for our spectrum support students, which is a much smaller population, of course, in the spring and the fall, we were able to get 54 students to fill out the survey, the Pulse survey, that asked several questions. This was one of them. How were they getting, were they getting involved on campus? How was their mental health? How was their physical health? It was really just to kind of get a pulse for how the students were doing. And our numbers were very similar to what you can see what the RIT numbers were, which 56 or 58% of students were saying that their mental health in the fall semester was fair or poor. Coming into the spring semester, the RIT numbers were pretty, they changed a little bit. You can see we had 52% students indicating fair or poor, but for SSP students, which we had 78 students fill out the survey in the spring, we work with about 100 students. A majority of our students were saying that their mental health was good or very good. And one of the things I think is that access to staff and that connection. And you can see the other question that we asked in the Pulse survey that RIT asked and we asked as well was, do you feel like somebody at RIT cares about you? And the numbers for RIT students, you can see about, if I can add that up quick, 89% yes, definitely, or somewhat. I don't know if that can be right. 33% of RIT students said that they did not feel like somebody cared about them. But the RITs, or the SSP students, the students that were supported by the Spectrum Support Program, a majority of the students, 94% of them said that they felt that someone cared about them. And most of them, it was yes, definitely. And I think that just having that connection to students, so I can see now that my numbers are not adding up, but the no's for RIT is definitely the right number. I think I gave you the 54 from, should have been 34. Having that connection with staff, having somebody there that knows you and cares about you makes a huge difference for students.
And then when I, coming back over at Westchester, when it came to the mental health standpoint, what we ended up finding is that generally we do monthly workshops with our counseling centers. We actually brought them in to do every other week counseling, like workshops with our students, check-ins with our students. Something else that we noticed too is that I said that, there are different types of group chats that go on within DCAPs. There's the announcements, but then they have a DCAP social. And what we noticed in there too is that a lot more of the students were talking in there. When something was bothering them, they were bringing it up and they were talking amongst each other to try to help deal with the mental health statuses. Apps that our students would use too oftentimes were, we wanted them to have some, whether it be for meditation, some positive inspiration quotes, just going into some mindfulness. So Calm, Headspace, and the Mindfulness app were the three top ones that our students really liked when it came to meditation and things of such. And Shine was more for the positive quotes and inspiration throughout the day. So they found those four apps extremely helpful throughout the semester, or throughout the year, I should say, not even the semester, throughout the year. So when it comes to social recommendations, I will say, I talk about the social piece. My students very much so were like, we just want to be in person. We miss our friends. The social piece was really hard for them. So one of the things we knew that we wanted to provide as programs were, one, more of those virtual engagement events, right? Whether that be through the gaming platforms, the group chats, watch parties, whatever it could be to get them to become engaged more virtually. And then also remembering that it's not just DCAP that's still doing these things, that there are social networks across campus. So reminding them of the campus clubs and organizations that are still taking place virtually. Making sure that you understand about the campus events and the activities, the connections with their academic groups, talking to their advisors, so that they didn't forget that those organizations were still taking place. So, and how we put that into practice. So I put up the 5 most popular games that our students actually use, and that was Scriblio, which is like Pictionary, Kahoot, Gartic Phone, Among Us, and the Jackbox games. I think I'm done with them, but they are still a hot thing here at DCAP, where it's a nice way. They use Discord as well as a gaming platform. I didn't put it up there, but that's something new that they've really switched over to. As for the campus organizations, one of the things we were fortunate to have a couple of our members actually work in what's called RAM After Hours, which is even in person. It's Friday nights, being able to go there, and RAM After Hours continued virtually, so reminding students to go there. And then our Hangouts actually increased to 7 days a week. And the wonderful thing about it is they were all hosted by students. It was no longer DCAP staff. It was the students coming together and hosting Hangouts 7 days a week.
And I think we just want to wrap up, but this is the other part of the Pulse survey. We asked students if they participated in at least one activity that helped them feel connected at RIT, and found that our students were still participating in activities. We did a weekly community meetup in hybrid. We had a Discord. We did some summer engagement events, and 60% of the RIT clubs were still active in some capacity. So we really push our students to those RIT clubs so that they can connect with peers.
And then I just put some year of the end of the year data in here for DCAP. Think about satisfaction from our students. You will see that almost 58% were very satisfied, and 42% were satisfied. As for what they were most grateful for from DCAP, as you can see, is just being accessible, there to talk to, right? Being there. And then suggestions from students for fall of 2021. This is what Jess was alluding to earlier, is they want to continue some of those online options. And one of the online options, Laurie, you see I highlighted it here, was the study hall. One of the things that Laurie had talked to me about, I was saying, what do we do for the motivation piece? And she had actually mentioned, she goes, we started online study halls, just virtual study halls. They come in at a certain time, they're online, sometimes cameras are off, and they're just studying. And that is something that our students really want to continue on those options. And the second most famous one was more interactions, please. And that is us wrapping up. So here is our contact information. Sorry, I don't know where I went there.
I just loved how the cat meowing ends it. Thank you all so much. So much content, so much to process and make sense of. Recognize that there have been a bunch of questions in the chat. Want to make sure that they're all addressed and hopefully concisely as well. Theo's questions are twofold. Did you consider that there are benefits? Excuse me. Did you consider that there may be benefits for students with autism in terms of? I'm assuming, Theo, if you might want to clarify online coursework, would you consider comparing these results to students without autism and how the answers would differ? So if you might want to elaborate on that.
Yeah, and oh, sorry, go ahead, Theo.
No, that's okay. Okay, because we assume that it's leading to more problems or more anxiety, but as you notice yourself, the possibility of online support was they liked it. So what we found in Amsterdam is that, for instance, for many students, online teaching is also beneficial because they can, for instance, look at their own pace, colleges back, and there are some benefits in it. it's not
Yeah.
the same as being happy about it, but it is sometimes more effective. So my
Yeah.
question, that's for the general population. So that's always my question. Is it unique for students with autism? And the second is, are there also maybe benefits? Yeah.
Yeah, I think it's a really good question, one that we definitely talked through. Where we landed was, we need to turn this around fast, and because we need to use this for programmatic stuff. That was like the initial purpose of the thing, was like they just wanted data on how to like run the programs. And so we decided not to look at a neurotypical sample, because one, my big thing is like the researcher would be like, we did not have time to try and find a sample that we could match appropriately. And then what am I really going to be able to say? Like, I found this random sample and then this random sample, and it wouldn't be as like valid or rigorous. You know, you just talked about a matched sample paper. So that's kind of why we landed on like, let's just get this done for this population so we know what we should be doing. But doesn't mean that would have been like a really good, fascinating one. And then I see your comment right below about the theme, the miscellaneous theme being predictability. I think that I may have just been talking about it too much and not mentioning the other pieces of the miscellaneous category that like I couldn't pull from my brain. But that's kind of what I'm thinking. Probably happened there, Theo.
Yeah, so I thought, because I saw many of those words were about, will all the things I know still be the same, or is it going to change? That to me, that's all about is my surroundings, are they still reliable, and can I count on it or not?
Thank you for that. Okay, so next question from Kristen. Did vaccines come up as a concern at CSI? They have very split and often are resistant to change perspectives on vaccines in the mentorship group. So lots of misinformation on vaccines seem to be spreading, and often from parents to children. So if the team could maybe address if that emerged at all.
Not a peep in our data. I don't think anyone was really talking about vaccines when we sent out the survey in early summer of 2020. But nothing that came up there.
Laurie or Cherie, did you want to jump in? Or
No, I think Jess is right. Nobody was talking about vaccines in summer. We had just gotten through the spring, and this was a prep for the fall, where we weren't really thinking about vaccines at all. Like Jessica said, our main thing with this was really trying to figure out what do we need to do in the fall. You know, we just got through this spring semester where what all of us did is just did the best we could, right? Our students left at their spring break time and didn't come back. And we just managed our way through like the last, 6 or 8 weeks of the semester, whatever it was. And then we thought, okay, what are we gonna do for the fall? Like, what is this really gonna look like? Now we have to actually figure out how to make our practices, like we can't just put Band-Aids on. Let's figure out what we can do, because we're probably going to be doing it for at least a few semesters. And so it was really about figuring out how do we adjust our services to make sure that we're serving our students well under COVID.
yeah, thank you for that context. The last question / comment that I'm seeing in the chat at this point. Actually, it's both Patrick and Jen contributed to this, and I'll try to summarize it in the interest of time, but essentially the notion of almost reacclimating, coming back into an in-person context following COVID, and wondering about perhaps concerns that may emerge in terms of, for many folks feeling like this desire to be around other people again in person, but perhaps not everybody feels that way. And just the notion of how there has been a certain comfort with COVID and handling things remotely. So just the notion of that there have been certain upsides with COVID in terms of engaging with folks virtually. hopefully I summarized that well enough, Patrick and Jen, but if any of the team members want to briefly address that.
Yeah. I think as someone who is neurodivergent, I'm not autistic, but I am neurodivergent. I am terrified. Like I feel emotional reading your comment, Patrick, because I'm starting to think about what this means for me when I have to start engaging in the world again. Look at it's happening. So a lot of anxiety around that, because quarantine has been very good for my brain, and for lots of pieces of my brain. And so while our study happened before I think anybody was really even like imagining what it could be like to go back, it would be really, I think, important work to do a similar-ish study now where we talk to neurodivergent people to kind of get a pulse and get a sense of like, okay, we just did this study a year ago where we needed to know how to help in quarantine, and now we're coming out. What do we need to do? How do we help? So you can email us if you want to jump on a study like that.
And I agree. I'm going to jump in here, Jess. I completely concur with you, because I think of our students. We've had some students that are coming in person. When it comes back to the vaccinations too, I will say that majority of our students, over 80% of them, are already fully vaccinated. There was the Eagles Autism Foundation that actually did a sensory-friendly vaccination, and there was a lot of information that was put out, and our students really talked about it because they wanted to become vaccinated, and they participated in that. The other thing that we're seeing though now is, even if they're fully vaccinated, PA is lifting the mask mandate. And when we're seeing that, there's a lot of anxiety. I listened to 3 conversations this morning about it, but wait, you're not wearing your mask. Even at graduations right now that are taking place, Westchester University lifted the mask mandate for this weekend, and my students are already asking about it. And they have called out people on not wearing their mask. So I hear you, Jess. I'm starting to see it amongst my own students of where's your mask? And there's a lot of anxiety of coming back to campus of people not wearing masks.
Yeah, very complex issue for sure. And yeah, I mean, I think I can speak on behalf of everybody. We appreciate a study like this debuting, something that's ultimately timely. I know the data comes from now about a year ago, but in terms of the insights and takeaways from it, that will hopefully reform practice and build understanding in terms of meeting students' needs and strengths in virtual settings as well. So really appreciate the 3 of you coming on today, and certainly to your co-authors as well for putting this piece forward. We are at the hour mark now. Time does pass by very quickly when we're learning and hopefully gathering some really good insights along the way. We will see all of you soon. Our next Canvas meeting is tentatively scheduled for Friday, July 16th. We are going to be going over to Fridays as our primary day, but there will be some variation in time according to folks' time zones and trying to meet folks' needs. So be attuned to that. We'll provide more details on our speakers and their topics in the coming weeks. So just keep your eyes peeled on that, and we'll certainly have notes and a video recording from today available for folks in just about a week, most likely. So thank you again to Jess, Laurie, and Cherie for being here, and to all of you for joining us. And we'll see you online via the listserv, and we'll see you right back here in July. Take care.
Thanks, Brett.